Welcome to ComplyPlus Presents, looking at some of the topical issues in health and social care sector. I'm joined by Louis Normoyle, my colleague. As you know, he normally hosts this podcast, but because there are a lot of things that relate to what he actually does day to day for Landpark Systems, that's why we are bringing him to the hot seat to talk to him. How are you doing, Louis?
Yes, apart from the weather, all good. So,
Yeah.
looking forward to discussing today's topic. It's quite interesting and quite topical based on even some of the things we've attended recently or even some of the conversations we've had with some of our clients.
Yeah, so we are talking about AI in the health and social care sector, particularly in relation to workforce development and training. There are other issues, obviously, that are related. We're talking about compliance, you're talking about governance, all those things will be covered. So normally we are looking at what's shaping governance, looking at digital transformation, workforce development across the sector. One theme that keeps coming back over and over again over the past 2-3 years is artificial intelligence. Even the Prime Minister here in the UK is constantly talking about how we should apply artificial intelligence, whether it's local government, whether it's the NHS, it's the care sector, it's schools. And what we have found more and more over the past year, at least, is that people are now asking whether we've got AI tools,
Yeah.
whether our systems actually are driven by AI. Quite what they want to know sometimes is not clear.
I think it's also a case of people not knowing what they're asking as well.
Exactly.
They just hear AI
Yeah.
from, like you say, important people like the Prime Minister or
Yeah.
bosses or shareholders or whoever they're answering to or what news they're sort of looking at. And they just know that they need some sort of AI, but
Yeah.
they don't really know what they're asking for. Yeah.
Exactly. So there's the hype around AI. There's the reality as well. There are risks related to AI, and there are real world opportunities. So it's sort of a balancing between what people perceive it to be, what they want it to do, and what it can actually do.
Yeah.
Because we were talking about this a few weeks ago at a conference in London with some healthcare leaders to say there's a tendency to talk about features
Yes.
of software, compliance
Particularly
software,
software applications.
learning management systems, but not actually what it's going to help to do. People are selling features and people are buying features that may not necessarily add any value.
Yeah.
Yeah.
Or features that either might not be relevant or, as you say, they won't even be able to use them. I think they're the three common problems which we touched on last week's episode as well. Yeah.
Exactly. So, look, why AI? Why now? So, Louis, I'm going to ask you a very obvious question, which is one of the most common questions that we got in advance of this. Why is AI? Why is everyone suddenly asking about AI in health and social care?
Well, I think it's a societal thing now, isn't it? We used to use the word Google it. Now we're maybe transitioning to ChatGPT it or Ask AI rather than Ask Alexa, Ask Google, and all the other patterns we've had over the last sort of 15, 20 years since the millennium. But I think the main reason is the rise of the generative AI tools. Like I've already mentioned, ChatGPT. You've now got Copilot, Claude. They've made AI accessible to everyone, and the entry level is so low. Even the paid versions of the products are very accessible to anyone, really, near enough. They're not necessarily just targeting businesses. They're not targeting high net worth individuals. They're bringing it in. They want everyone to use it. They want it to become a lifestyle, whether that's in your business, whether that's in your daily life, and it's here to stay. So, like I say, people are now, like I say, trying to use it for efficiencies in their business, which obviously makes sense. How are we going to apply that AI? And I know we'll go into that later on. But like you say, the key really is to make sure that AI is adopted properly and we understand what it can do, what it can't do, and also what value, like you say, it's going to add. Because it isn't just a case of, well, if we can streamline this or we can get rid of this amount of people, we can raise profits this way because the AI is quite cheap. It isn't quite that sort of playbook that maybe some people are making out. Yeah.
And one of the things to really also talk about here is the vendors. So we would be considered vendors as also companies that are supplying software tools for compliance, governance, and workforce development. Everyone is not talking about AI-powered insights.
Yes,
AI will
or
do
AI
this.
enabled. Yeah,
Exactly. And what I've noticed, because some of the clients we work with, obviously, you get to see the other systems as well. I think some vendors are over-promising what AI can do. Some of them are literally just tagging ChatGPT or something similar into their system.
yeah, it's like a bolt on.
It's a bolt-on whereby you may as well just go and use ChatGPT, really. And,
Yeah.
and I think it's quite misleading sometimes and also unethical and potentially quite risky
Yeah, depending on
for
what data they're putting into that AI
exactly.
machine. Yeah.
Yeah. So even when the AI barely does anything at all, if I label it as AI powered insights, then people are going to buy the feature because well, we all need AI now.
Well, yeah, exactly.
Yeah.
That is the mindset, and even with customers that I deal with, that is the mindset. It's almost, when you develop things like playbooks and what questions are you likely to be asked, that one is creeping up in our list.
Yeah.
What AI do you have? Do you
Yeah.
have AI?
So I asked the team to give me some questions, and one of the questions is, does your system have AI? And as if AI is some sort of new gold standard. We have been using AI tools for a long time, right? But we'll go into it properly.
Yeah.
And then the other one is, so if they ask, does your system have AI? Then the logical thing is to ask, what do you need AI to do, right? Because actually, it's quite vague when people just want AI for the sake
Of course
of
it is, yeah. It's very vague. It's almost like saying, where do you want to go on holiday in Europe? And on holiday, and you say Europe. It's almost that vague. So I think that, like you say, the main problem is many leaders ask about AI because they know they're falling behind,
or they fear
or
falling
they
behind.
fear for falling behind because they think if we don't have AI, we're losing, and other people are starting to get it and utilize it, and we're falling behind. But it's not because they've actually mapped it to a gap in their business or an operational need. So I think it's almost like a bit of FOMO to sort of say this company or this organization or institute have got it. They've put this thing on their website or social media about how great, how revolutionary it's been. Like you say, almost as if AI is completely new in the sector. Which
So FOMO, you mean
which
fear
we
of
are.
missing out?
Yeah, FOMO is fear of missing out basically. So then you even see patterns in terms of the the forms that get filled on the website or the engagements you get. You see one or two case studies go out, and then all of a sudden a flurry of similar businesses offering the same service offer. And then if you do a bit more digging, you might even see that some of them are in the same geographic location. Or they're supplying the same contracts, or there's some sort of conflict of interest between those businesses. So it's almost like, again, that power of referral has gone round, and you sort of think, oh, okay, so that's how people are asking. That's what people think. But it is a common misconception, and I think it will be for a while.
Yeah. So if we can explore that a little bit more to sort of think, what customers think AI will do. If we unpack that a little bit more, when they say, does it have AI? In your experience, what do they actually mean?
Yeah, so I think like I said, when we were doing the research for this and I was speaking with our teams who are more on the customer facing side, there was three things that we'd come up with. The first thing is, usually people are asking to sort of say, will this automate all my compliance work? So all the stuff that, particularly the manual tasks they're doing, they will want it, especially in relation to compliance, they will want the AI to not almost, they want the AI to do the work for them. The next one would be, it will fix our culture or performance issues. So to sort of say, look, if we bring in AI, it's going to uplift staff, it's going to help how people are working, it's going to increase performance, people are going to like it because they're going to have maybe less to worry about or less to think about, and then the culture then magically improves. And the third one is, will it give us instant inspection readiness in particular, or even results? So people think by, like I say, bringing this AI in, it's going to actually help us be more prepared when CQC or Ofsted or whoever come knocking, or local commissioners or whatever, or actually it will just improve our result. We'll go from below expectations to good or above average or outstanding. I think people almost think it can have that sort of an impact that quickly.
So just bringing it in, if I go back, you said whether to automate compliance work. So AI will somehow magically do the policies, audits, reports, training records automatically. Is that the assumption?
That is the assumption, yeah, because people don't want to waste time drafting policies or pay lawyers or solicitors to do that. They want something that they can pretty much say, look, I've paid you. We're a care home or a GP or a dental practice. This is what we do. We're the same as everyone else. I want it to create a policy, send it to my staff, make sure I've got an audit trail, an activity log. I want reports. I want to know when this is running out. I want to know when that's.
So that's a lot of prompts already.
Yeah.
I'm sort of thinking, I think you've mentioned about 6 things already,
Yeah.
but each of those actually would need very specific prompts, and it would need them to be tailored
Of course, yeah.
to that particular service. Because, I mean, traditionally we've had people sharing policies and procedures. We've seen that a lot, where you go into an organization, you're working with them, and you just want to look at their policy for training, for example, and they haven't even bothered changing some of the detail from the other company. They just put their own logo there, they put their name, and very minimal customization. So there is a danger then of over-reliance on AI without the AI literacy, because we know that it hallucinates, for example, isn't it?
Yeah, of course, yeah. And if you've got that digital literacy issue, AI can become more of an enemy than an ally, really. Yeah.
Yeah, so we talk about the double-edged sword, isn't it? To sort of say it's so powerful, it can give you those tools, but you have to know how to use them. But I think we'll probably need to come back to discuss some of the culture and performance issues. Clearly, we're saying that AI can help you support your processes and improve productivity,
It can,
but
yes.
it does not replace leadership. It does not replace your job, actually, as far as thinking about your systems and customizing to what you want done.
But even like you say with culture, AI can't change a workplace culture.
Yeah.
AI can enhance performance, but it won't turn performance round overnight. There needs to be a plan. What's the purpose? How augmented is it between the people actually delivering the care and the people using the AI? There's a lot of things to consider, a lot of planning to be done, and then a good implementation plan.
Yeah.
And if you do those things properly, in 6 months' time or 12 months' time, depending on the scope or the level of the project or what you're trying to achieve, you will see the benefits. Yeah.
Okay, look, so we're saying that when we looked at health and social care organizations that were failing CQC inspections, whether they require improvement or they were on the other end, there was poor governance, Regulation 17, Regulation 12 around safe care and treatment and staffing as well. AI is not going to magically fix that. You need a good governance structure.
Yeah.
You need good documentation processes. It's not going to fix the work with the training cultures if they're weak. You have to have that strategy, and you have to have good supervision systems. It can only enhance what exists already. And the way I look at it also, if you look at the reality, what it can actually deliver depends on your needs as well, your specific
Exactly.
needs. Because there's some things, if they're working very well, why deploy AI there?
For the sake of it.
For the sake of it, right? Considering some of the disruptions. So let's talk about grounded reality, on the back of that. What AI can genuinely deliver today for health and social care training, particularly, or workforce development in general.
Yeah, so I'd narrowed this down to sort of 4 key areas, really, where AI will add real value. And the first one is using AI as a learning support tool. So we're looking at things like intelligent search inside training platforms. We're looking at things like AI tutors, where people can get information quickly and take things further than just actually the content that may actually be within the LMS or within the structured program, and also as a way to guide and help staff understand policies, legislation, and even best practice recommendations. If they've got some sort of AI there that has real purpose and conviction, it can really aid people almost on the job at times as well, depending on how accessible the LMS is that you've procured. The next one would be for training analytics.
Yeah.
So you're now looking at ways of quickly crunching data rather than sifting through, old school rigid Excel reporting or CSV reporting for others. So you can spot patterns in training data quickly. You can flag overdue requirements quickly, whether you're using notifications from AI or mini reports, even daily things, logs, activity logs, highlighting teams with recurring skill gaps as well. So like I say, going back to the trends idea, if a lot of people or people in this department or job role are struggling with this particular element of their training, whatever it may be, whether it's mandatory training, whether it's some specialist training that's been brought in, AI will be able to flag that. If you ask it what you want it to flag, and you can see recurring patterns. For example, if a group of carers in a care home are all struggling with safeguarding, for example, it might mean that there's issues with the policy, there's issues with understanding, there might be need for additional training to be added. But if you're not looking at those metrics, or you've not got a way of the system telling you those metrics, how would you know? Because just because people get a certificate at the end, for example, how many times have they had to do the assessment to get to pass, or to say that they're competent? If one of your members of staff are taking 6-7 attempts, for example, to get a certificate for something, then that should be worrying, and really you should know about that.
But these sort of insights, we've had them for nearly 10 years.
Yes,
they're not new. Some of these
no.
things.
So some of the things aren't new, but I think it's the way you access them
Exactly.
is new, and the speed, because no one has time now, do they? Every year, people are trying to see where they can save time, whether it's their personal life, whether it's their work life, and that's what AI has enabled, and it's consistent.
Yeah.
Unlike people, if you ask someone for a report every Friday, the AI will never forget. If you've asked it to send you a report by 8 a.m. on Friday on your desk, the AI won't forget. Whereas, as we know with people, sometimes it might arrive half an hour late, you might have to nudge them to get it. And for those efficiencies, AI can obviously be really, really critical. The next one is AI-assisted content creation, with obviously some sort of human oversight, because you can't 100% rely on AI, which we've said several times on this show. But things like drafting learning scenarios, quizzes, reflective questions, all those things are really, really good. Even using things like case studies, looking at, like I say, recent case studies that can be brought in and used as real life examples, which sometimes training, is missed upon. You look too much at the theory, but do you have a real world example? You've got things like accelerating content development, so how rapidly you can not just create content, but also update it, particularly when things are changing very quickly here in the UK at the moment. I think it's a big advantage. But like I say, you can't ignore the human element. You can't just create content using AI or put a load of policies into a generative AI and say, create me a course out of this. It will probably create a pretty good course, to be honest, but without that human oversight, I think it's really critical,
Again, I remember we attended that public lecture at the University of Westminster a few weeks ago, and Professor Mtambara was saying, if you are getting hallucinations from AI, then you don't know how to use it. So I think everything goes back again to literacy, to sort of say, look, where can we use it and how? Where
do we use
exactly
it,
do we deploy it? Like you're rightly saying, it's important, even when you're just developing content. Before we were using AI tools, you still needed to do your research, right? Do your training needs analysis, organizational needs analysis. Then you're going to do your research to say that, look, where can I find verified content? And that's a key element as well, to say what is the knowledge base behind. Because if I just go to Google, or if I go to ChatGPT, it will just give me results based on many different things. Right? And some of that content actually has no validity at all if you're going to scrutinize it. So I think it's really important for managers and decision makers actually to understand that the fact that it gives you results does not necessarily mean that those results are worth even
gospel,
using in your organization. They could bring a lot of risk into your organization. So look, these are powerful applications, and you're saying that you need the safeguards, so we need some guardrails to ensure that actually they fit in our governance framework. And you definitely need the human oversight. You're not going to replace your trainers overnight just because you've got access to AI tools,
Yeah.
right? So, as you were saying, AI is an assistant, not an assessor.
Not the assessor. Yeah.
You know, so you still need that human level element. So we, even traditionally, when you look at health and social care training, it's based on vocational courses whereby you need people that deliver the training, right? And then those people then need to design the training and assessments to meet the goals. So you need the aims, objectives, and learning outcomes. And also you need people that are doing quality assurance. So assessing actually to say, look, we've developed and delivered the training to meet those aims, to meet those intended learning outcomes, because otherwise that certificate is worthless if we don't have those sort of systems.
Exactly that.
Yeah, fantastic. So look, we have seen scenarios where AI goes wrong, and people bring in new risks. They misuse it. There's safety issues, data protection issues. What concerns you most about how AI is being used in the health and social care sector, based on your experiences? Because you work with people to deploy these software tools, don't you?
Yes, yeah, and there have been some horror shows even on the news. If you know where to look for this sort of news. So I think there's a few big red flags. I think the main one that we've come across, and is pretty obvious when you put your sort of DPO, information governance sort of hat on, is data protection and confidentiality. So, some providers have even pasted data directly into ChatGPT regarding patients, and that's just a breach straight away. And that's a huge issue. But there are other examples where data protection and confidentiality have been breached just by using a generative AI tool like ChatGPT. So that's always something we should be thinking about. Even as helpful as the AI may be or can be, we still have to follow laws. We still have to follow rules and policies. The next one is the hallucination and incorrect guidance side of things. So like you say, AI may come up with something that looks really credible and sounds great, reads really well, but may actually factually be wrong in some areas. So again, if you don't have that human oversight, if you don't look where the references are, sort of say, where's this data actually come from? How credible is it? How accurate is it? Have there been any changes? Because I think the common one is when, even with things like safeguarding and so on, there's actually been some law changes that maybe the AI hasn't picked up for whatever reason.
Even data protection itself, isn't it? The updates.
There's updates. More frequently than probably people think. We, the general public usually hear about the big ones, but there are other updates throughout the year. I know there was one in June this year with GDPR even. How many providers know about that? We don't know. So then the final one as a red flag really is the impaired professional judgment. So, some staff rely too heavily on the AI, so it almost thinks for them and almost tells them what to do, and maybe also creates things like self-doubt, even for professionals who may fully understand what they're doing, but they've been so used to now using AI almost overrides their decision-making process, which can obviously be very, very dangerous depending on what setting that is in,
Yeah. So actually, sometimes it's used to replace people, but
Yes.
without the guardrails, without actually understanding some of its limitations.
And also the loss of common sense as well at times, I think. So there's those are some of the key red flags. There was two others that we'd come up with as well. The misuse in training, which I know we slightly covered earlier, but you use companies, like I say, some companies are now even not even providers in our space, but actual people delivering services in health and social care. They're thinking, why do we need an external training provider? Why do we need an external compliance? We can do it in-house. We've got AI.
I've seen people bragging about that, even on LinkedIn, actually, to say they're almost trying to sell their AI content development service. And then you look at it and think, God, it's literally like going on Wikipedia and then just downloading what's on Wikipedia
and putting it into a nice slideshow or something,
and then you have training. We would never have imagined doing that just 3 years ago. But how is this acceptable now?
Now, some people think it's a norm, and again, you can cut things from budgets. You can save money here, but at what cost? So misuse and training is a common one, and it's probably going to be on the rise. unless it's clamped down in some way. And the final sort of red flag really is the false sense of compliance security, to sort of say, oh, we've got a system, we've got AI, so it's going to predict things like inspections, it's going to write policies, it's going to manage overall compliance. We're never going to miss someone running out or working without the right to work or whatever it might be. AI is only as good as the people using it, which I think we've said on some recent podcasts
still need that.
as
You
well.
still need that governance structure
Exactly.
in place and supervision.
Exactly, and it won't just mean that, well, we have AI now, so we're going to be outstanding. We're going to pass all our inspections. We can put our feet up. We can focus on other things. The core things that are needed to run these services still need to be taken very seriously, even with AI. Yeah.
So obviously, I remember I went to the patient safety conference a couple of months ago in Manchester, and there were questions around this, even to the regulators who were there, to sort of say, look, how are regulators like CQC, like Ofsted and others going to hold providers accountable for AI misuse? How well equipped are the regulators themselves, actually? Because even the children's services one we went to in Birmingham, there's still a lot of questions, isn't it? To say, can regulation keep up with the pace of development? Because right now there are no guardrails, as far as I'm aware.
No, there isn't. It's almost like a free for all. So,
Yeah.
like you say, I think when it comes to things like accountability in particular, if you're drafting a care plan or a policy and something goes wrong, it's still going to be you accountable, not the AI. And I think if you keep that mindset, then you should use AI in a more ethical and fit and proper way, let's say.
Yeah. So look, it nicely sort of takes us to safety, ethics, and adoption that is aligned to the regulations.
Yes.
Because obviously, whenever you bring any software tool, because even if you go to the basics of GDPR, Data Protection Act, it's one of those tools actually that brings a lot of risk. And then from the Information Commissioner's perspective, you're supposed to assess the kind of risk that it's going to bring into your organization. And if you're going to put staff data into the AI tool or patient data into the AI tool, already that's a huge breach.
Yes.
Because you don't control that system. Unlike other systems that you control within your organization, once you start putting information onto tools that are outside of your control, you're already in breach.
You're breaching, yeah.
So obviously there are a lot of opportunities with AI. We need to think about the risks. But maybe let's look at the ethical, safe, and practical adoption of AI. What does it look like in the health and social care sector?
Well, yeah, again, when we were looking at this question earlier this week, we sort of brought it down to 5 sort of key principles. The first one being human validation. So looking at no AI-generated content should be published without expert review.
Yeah.
If you have that sort of policy in place, you shouldn't go too far wrong. You've also got things like the AI accelerates and humans approve. So whether you're trying to improve a process, whether you're trying to write some policy, whether it's care records, whatever the scenario might be, you have to have that level of quality assurance and validation in. Otherwise, if you don't have that principle, you're not going to go anywhere, and you're going to get yourselves into trouble ultimately. Input controls, I'd say, would be the second principle. So we're looking at we don't want to be feeding patient data, staff records, or identifiable information into public AI. As you say, it's not a system you control. Even if it's bolted onto something, you're still putting it into a database and a resource that you are not in any control of. You don't know how that data is being processed. It's high risk and against the law. It's really important that we use private, secure, sector-specific AI systems. That, for me, that's really important, particularly in the health and social care sector, with the sort of data that health and social care organisations, possess or hold or process. We also want evidence-based sources. So AI should only draw from verified, credible, regulator-aligned content, as we said earlier. It's really important we check the references. We don't just want random things off the internet that maybe are ranking highly in Google, or random blogs that a professor has wrote or this person's wrote that doesn't actually necessarily mean align, with regulation or legislation.
Because when you think about it, the way AI tools are trained, they are trained based on publicly available information.
Exactly, yeah.
For example, the Wikipedia pages, which can be edited sometimes to
Falsify
present a certain
things,
view, Reddit, and many others. So, when you think about it, if you're going to develop content, you don't go to those sources as a general rule. You may go to them just to establish sort of your initial impressions, but actually, if you're going to rely entirely on those sources, quite often the evidence is quite scarce in those sort of scenarios, isn't it?
Yeah,
Yeah.
yeah, definitely, definitely. So the last one, and pretty much the most important one in a way, is governance first, technology second. We want to make sure our policies state things like what AI can and can't be used for, who approves its output, and that should obviously be on the human side, as we discussed earlier, and how accuracy, is assured. How do we know that the information or the output from AI is actually accurate?
Yeah.
And that's where that human validation comes in.
Yeah.
But we have to have the mindset of governance first, technology second. It should always be inferior to governance.
Yeah. But then when you look at right now, we are automating at speed rather than augmenting. Shouldn't it be the other way around?
Yes, in many ways, because like you say, AI is going to support things like training, reflection, data insight, decision support. It will help with all those things, and there are use cases right now across the world where it has, even in the health and social care space. However, it's not going to replace things like supervision, leadership, culture, professional judgment. It's not going to overtake those things. So that, like you say, it should be as augmentation, and the professor that we saw in Westminster, I think, put it perfectly on how humans need to use and utilize and manage AI across the world, really, in multi-sector, but particularly in health and social care, because there's a lot to gain, but there's also a lot to lose if it's not used properly.
Yeah. So it has to operate within the governance framework of the organization, and rather than replacing governance. Because although that may look like you've got, you talked earlier about the input controls. Yes, you can get that output, but actually, if you don't control the inputs, then it quite often it doesn't serve the purposes that you intend.
No, because it's that old IT saying rubbish in, rubbish out, isn't it? So if you go to the start of the journey when you use a generative AI tool, if what you're putting in isn't clear, or you don't really know, there's no purpose to what you're putting in, or you're putting in a load of garbage ultimately, then
you get garbage
the
out.
output's going to be poor.
Look, so we want to look at the positives as well now, and also practical tools on how we can, how health and social care providers can be better prepared for AI adoption. It doesn't matter whether it's NHS, it's a small care home, it's a large domiciliary care provider, right? What should they do if I'm a decision maker in a health or care setting? What should I do if I'm considering using AI tools? Let's say I haven't even started doing anything. What do you recommend?
But that's not a bad place to be even now, because it allows. I think the key thing is to, like I say, step back and map three key things. What are the real business needs? What does the business really need right now? Rather than thinking what AI can do to help you, what does the business need? I think that's a really crucial first step.
Basic needs analysis.
Yeah, basic needs analysis, organizational needs analysis, across the board, if we're going to do it properly. What is the digital readiness of the business? And that's not just necessarily highlighting individuals. It's not just highlighting the people, on the ground doing, actually giving the care. What's the leadership structure like? How are they? What's their digital readiness? It's across the board. So again, a broad sort of audit or review on that is needed. And then what is the capacity to govern AI outputs? Because AI can work obviously very fast. But if you don't have the capacity or resource to manage those outputs and put in that governance framework, as we've been discussing in the last segment, then you're just going to have a lot of outputted data that maybe actually you can't use because no one is validating it quick enough. And you get almost like a lopsided approach in your business where one area of it seems to be performing or accelerating really well, but then another part is delaying what you're trying to achieve as a business. So I think for me, they're really, really key things. If you're struggling with policies, don't necessarily leap straight to AI. Fix the governance side first. Fix the bigger problem first, or what's maybe causing, why you don't
Those
have a
gaps,
policy
yeah.
for this, or a gap for this. If your training compliance is weak, don't assume AI will solve the engagement issues. For example, look at things like culture, and culture cannot be developed or changed or amended using AI. It's a human culture is a human aspect, and it needs to be done by humans. AI may give you ideas on how you can improve culture, but it won't implement a better culture. And finally, if your team lacks digital literacy, AI will fail or cause more harm because people will put their backs up. They won't want to engage with it because they don't have that digital literacy. They're going to be scared of AI because it's been framed as a modern term now. So it's been framed almost as if AI is for younger people, it's for clever people even. But AI it's very powerful, but only if the foundation is strong. And you're going to scare people more than excite them and get them enthused if digital readiness is poor.
It can get in the way, isn't it? If you're not careful about it. And I mean, we did a whole podcast on digital literacy. I remember when I actually suggested that, and everybody was looking at me like, what can we talk about for 4 to 5 minutes about digital literacy? We ended up spending nearly an hour talking about digital literacy.
It ended up being one of our more interesting topics when you dive in and you look at mindsets, you look at culture, you look at leadership, you look at even society now. The young people of today, how advanced they're going to be when they're later on in life or in their career, compared to maybe some of the people who are at the end of their career now. They've had to sort of learn the harder way in a way.
Yeah.
So it was a very interesting episode. Yeah.
Look, these are really good points you've raised there. So understand your organizational needs. What are your business needs? Make sure you're ready, be digitally ready. So your strategy, you have an AI strategy, have an AI policy, know exactly what we want out of it and how you're going to ensure that it's governed properly. And then the capacity to govern AI inputs and outputs, really crucial there. Look, we're going towards the end now. And what are the key takeaways? I don't know whether you can do 3 or 5 takeaways for leaders so that if I'm a decision maker adopting AI already and using it for compliance and workforce development or thinking about doing that, what are the key things that I need to do?
Well, we'd sort of put 5 together for decision makers. If they're in that position, as Richard said, about adopting AI for health and social care training, the 5 things to start with would be AI is a tool, not a shortcut. If the fundamentals are broken, AI will magnify the problems, not actually fix them. Although you may think you're on a road to recovery in a way, it will be a false sense of security a lot of the time. The second one is safety and governance. It has to come first. Never use AI without those guardrails, without governance in mind. As we said earlier, governance first, then technology. Don't confuse hype with reality. A platform may say AI powered or AI enabled, but what does it actually do? Is it safe? Do you know why you need that AI? Rather than looking at what the AI does, what are your business needs? That's really, really critical before even thinking about procuring any AI or implementing any AI in your business. Invest in digital competence. So staff must understand AI. They must also understand its limitations and how to use it responsibly and be digitally ready. Have that digital literacy, or at least a confidence in digital literacy. And again, we've got a separate episode on that if you want some more guidance on how that can be achieved. And finally, choose partners, not promises. Pick vendors who understand regulation. They understand ethics. They understand training and what the significance of training on an organization, and even people that have those occupational backgrounds. They understand clinical risk. Don't just trust algorithms. Don't just trust the fanciest thing on the market or the thing that maybe is presented the best. It's really, really important that you choose people who understand your business and what you're trying to achieve and where you're trying to take it. And also trust vendors that understand the technology and how the technology can help you. They're not just selling you a product. They're selling you a service, an experience, and they're trying to actually help you achieve what you want to achieve. Because there are a lot of people coming into the space. And going back to some of the points Richard mentioned earlier about things being feature rich, there's different types of pricing, tiering, or different types of contracts people are trying to get people tied into. It all sounds great on paper and it's all glossed up very nicely. But at the end of the day, promises are not, they're not going to actually help you get to the next level or utilize these tools. People are just looking at getting as many users on their systems or as many people subscribed as possible and running with it.
Yeah. Choosing
the right partner is really critical, and you need to have a good selection process in place for that.
Yeah. Look, thank you for this, Louis. As we have discussed over and over again, we can see that AI is a double-edged sword, whereby if we're not careful, actually, it won't serve us at all. It could actually cause a lot more harm than benefit. Definitely, it needs to be governed properly. So you need to think about it. It's almost like any innovation, actually, not just software, this sort of artificial intelligence powered software. Any innovation that you bring into the business, do you need it? Right?
Yes.
What are you currently doing right now? And if you're going to bring this AI to, why do you need it? Don't just look at the features, look at the actual benefits and even the demo, actually. Get a demo done. Also, trial it actually in a safe environment to see how it works. Sometimes, actually, you don't need it at all. Some things actually just work better with human beings doing what they're supposed to be doing. But then if you bring tools, they're going to augment, not just replace people for the sake of it so that we can cut costs. It can be quite an attractive option, isn't it? And some of the tools on the market now, they're so cheap.
Yes.
I don't even want to say affordable. They're so cheap, actually, almost too good to be true. And quite often, actually, when things are like that, where people are selling all these sort of features, is there any substance behind those features? It's really important. You did say something about, if you're, we could do a whole episode where we're talking about buying or subscribing to software anyway.
Yes.
Right? Those rules actually don't go out of the window just because it's artificial intelligence. So it can definitely strengthen governance. It can enhance your training. It can reduce the workload, especially some of the admin tasks, definitely. But make sure that you test run it. You know exactly what it's going to do. You control the input. You control the outputs. You can audit it. It has to work with human thought alongside it. It has to work within your context of your business. And also, Louis talked about the organizational needs. So who are the service users? If it's care in the community with older people, it's a GP practice, it's a clinic, you need to customize it as well to your own local needs. So I hope this has been useful. Thank you again, Louis, for bringing your insights from the front line, working with health and social care providers, and for your insights as well.
No, it's a really interesting topic, and there are some more areas we'll go into with this sort of tech mini-series we've been doing, particularly in the build-up to Christmas. So I really enjoy these topics. If anyone has any questions out there, as usual, engage with us on socials, go to our website, fill in a form. Love to have a chat from you. Love to hear what questions you people have out there, or concerns you have, or misconceptions that you have, and we're happy to put something together. Thank you for today. It's a really interesting topic.
Thank you very much. We write weekly blogs, sign up to our newsletter to get some insights. We are active on LinkedIn, on Facebook, and X. See you next week.
Thank you, everyone.
Thank you.